Appreciate having a packed house. We're going to have a really robust, wonderful discussion in this breakout session. We're so blessed to have three individuals representing really strong institutions and organizations that are moving the needle in this state in the healthcare space. Today's theme is workforce triage, and there really is not a topic more appropriate to discuss in the triage space than the healthcare industry, because we hear regularly about the needs for healthcare providers to find high-quality, skilled professionals. We also know that Mississippians are bleeding for opportunity, and the healthcare industry provides that strong opportunity for transformational earning potential for families across this state and across this nation. The first thing I'd like to do is actually just ask our three panelists to introduce yourself, the organization or institution that you represent, and a little bit about your role and the coverage that you deal with in the healthcare professional space. Dr. Larman?
I am Dr. Brandy Larman. I am Dean of the College of Nursing and Health Sciences at Mississippi University for Women in Columbus, so North Mississippi. Within our college, I oversee our nursing departments, which we have an LPN transition program all the way up to a DNP program. So we have transition programs all throughout the college. We have an associate degree program and also a BSN program. So 2 undergraduate nursing tracks within our college, and then also an RN to BSN program. So several transition tracks. We also have health and kinesiology, so pre-PT, pre-OT, public health, just kinesiology also falls with me, speech-language pathology, so an SLP undergraduate and graduate program, and I think that's all that is with me. We have in our college about a little over half of the university's head count is within our college. So we are very much the campus, basically. We also have a very large online presence as well because of our RN to BSN program. So we kind of have branched out and done a little bit of everything to meet our students where they are. So a little bit of everything falls in there with us.
Thank you. Dr. Subarao?
Yes, my name is Dr. Italo Subarao, and I'm the Dean at William Carey University's College of Osteopathic Medicine. Just with a show of hands, how many folks know what a DO is? Have you ever? Yeah, about half of you, hands are up there. So let me just take a minute just to tell you what a DO is. So there are 2 types of physicians in the United States of America. We all know the MDs because there's much more MDs than there are DOs. But DOs, just like our MD brethren, we go through 4 years of medical education. We're called a doctor of osteopathic medicine because we do focus, we have some additional training in musculoskeletal evaluations and assessments, almost like a physical therapist, for lack of a better term. And so we look at that as a window to disease in the body. We do 4 years, just like our MD brothers and sisters, and then we go on into residency programs, and we can specialize into any area of medicine, get board certified in any area of medicine. We do the same residency programs as our MD brothers and sisters. But why a DO program? Why not just put another MD program? Why not just, expand UMMC? Well, first of all, we have an amazing academic medical center here in Mississippi, here in Jackson, a fantastic one. But if you train doctors and they get trained by specialists, guess what they're going to become? They're going to become a specialist, all right? And they're going to want to train and practice in areas where there are specialists. Well, DOs are a bit different. We go, the history of DOs is that it came out of family medicine, actually just after Civil War. And our focus really, it was born in rural America. It was born in rural Missouri. And from there, roots started to plant throughout the country. And so while there are about 1 million doctors in the nation, about 20% of them at this time are DOs, doctors of osteopathic medicine. Most of the DOs, over 50% of DOs, practice in primary care specialties, primarily going into rural and underserved areas are areas they're very comfortable practicing in. And it's because our curriculum encompasses primary care physicians. So our students are primarily around family medicine doctors, pediatricians, psychiatrists, things that are the bread and butter, obstetricians, doctors that we need on every block, if you will. And so when they're trained by us in their first 2 years, they go out into the community for years 3 and 4, into community hospitals and community clinics. And then we find that most of them get such a positive experience that they like to go into primary care. So one of the ideas that William Carey had back in 2009, because there's such a shortage of physicians in Mississippi, was to start a DO program. And for the sake, because the other part of the mission was to add more primary care physicians to this state. So that's what we do, and we'll give you a lot more details on that as we go forward, but it is a blessing and a privilege to be here. Thank you.
Thank you, and I know we're certainly thankful for your two programs. Good morning, my name is Jessica Lewis. I am here with Singing River Health System, and we are here in the Mississippi Gulf Coast, where we have 3 hospitals in Gulfport, Ocean Springs, and Pascagoula. We have over 4,000 employees with about 500 contract partners. And, healthcare, and that's why we're here. I am currently the chief HR officers, I better like to say, the leader of all the people department, because that's what's so important to us. And I'm so thankful that you all are here, because you're such an integral part of the new pathways and the new models and the new ways we need to be here with the state of Mississippi. And we look forward, but of course have all of the people side, but most importantly, into our heart, we have our workforce and our Workforce Academy. And those are some of the things that we're going to be talking to you guys about a little bit today, because it's a new way that we're not just talking about it, we're actually doing it with our wonderful partners and different things. So look forward to talking to you a little bit more about it.
Awesome. So Jessica, I'm going to stick with you actually for the first question. You're on the private side, you're in the hiring world. In our office, we like to talk about workforce improvement and how we're getting better. The first challenge is to identify the problem. And so from your perspective, you can back up before you've done some of the innovative things you're currently doing. What are the challenges for recruiting and keeping skilled professionals in the healthcare space in a rural state like Mississippi?
Sure. I mean, as many as you know, first, it's having the interest into the careers that you're doing. It's supply and demand, everyone. I mean, that's what it is. It's having and targeting those individuals to a wonderful career, right, for a lifetime. And just like Ryan was talking about today, it's so important to set up pathways where they can keep growing up, but helping them and pointing to things, because I don't know about y'all, but I still don't know what I want to be when I grow up, right? And I mean, people look at me now and I tease them all the time when I talk to my group, and they're like, you get a little old, Jessica, you better be figuring it out, right? But it's because there's so many wonderful careers. I mean, you sat there listening to Ralph, and half of y'all are like, what in the world is she talking about? Because we're like I tell everybody we're a city. We have more careers than you even know what to feed into. But it's leading these students to these wonderful careers and showing them the pathways of how to get there and giving them different options to get there, because that's the whole point. We're showing different options with Accelerate, but we've got to get that. We've got to get that skill set and being able to attract to those roles.
So, Brandy, when you're dealing with students, what are the barriers, to keeping quality students in rural Mississippi? I mean, you're training them right there in the heart of a place that needs them to stay and thrive.
Some of the challenges, I think, from the education standpoint is, first off, we we don't really have a lack of students. There are students that are interested and that apply. We, in some of our more rural areas, don't always have enough faculty for the ratios that we have to have, especially to take the students to clinical. So that's a big challenge. You often hear, that we'll build more space and build more space and we'll, take more students, and all of that is great, but we have to have faculty. So in some of our more rural areas, that is a huge challenge. That's not a problem in every area of the state, but it is in some places. Also, having students from more rural areas, they don't always have the financial resources. And so when something like COVID or even a smaller challenge is presented, they don't always have the resources to bounce back like some of your other students do. So you really have to be creative with your donors and your scholarship opportunities, and you really have to have resources for those students. That goes back into what you look for in faculty. You have to have creative, innovative faculty. It's not just your run-of-the-mill, instructors that you look for. When you're in a rural state, you want faculty that are resourceful and will get out there and will work hard and, are willing to really advocate for the students that you have, because they're not always going to have all the resources that some other students in other areas may have. And, we don't always have the clinical spaces that we would like to have. And so we have to use a lot of simulation and a lot of virtual reality and things like that. And, that plays into, your faculty as well. So
Dr. Subarow, you started to touch on it with your discussion of the DO profession, but physicians, they're a particularly challenging group, and we need more of them in the state. What are the challenges? What are the barriers?
Absolutely. And I think I just want to start with just a bit of a big picture here. Big picture, right? How are we going to have a dynamic and thriving and economically amazing state if we don't have healthy mamas and babies? How are we going to do that? All right? Because that's what we're about. That's what we have to recognize. That's why I appreciate Accelerate Mississippi. That's why I appreciate what's going on with the thinking about using, looking at ways to transform, truly transform. And one of the challenges we have is over 50 counties in Mississippi don't have a pediatrician or an obstetrician. That's a challenge. When we say access to care, that's a tremendous, think about having to travel that type of distance. So what we've been able to do with our program, and we have done this with, we've done this jointly with the Office of Mississippi Physician Workforce. We take our students in their 3rd and 4th year, and they go out throughout the state of Mississippi, in all parts of the state of Mississippi. And they started at community hospitals where they're rotating and they're becoming part of the fabric. The value proposition for a family doctor or a primary care doc is very different than that of a dermatologist or a plastic surgeon, okay? You're gonna make, on an income side, you're gonna make less, all right? That's the reality. But is that what life is about? Is there something greater to what we're made of? Do we not realize some of the other benefits that we can have with our ability to contribute to society and lift society up and have a leadership role? And I think what happens is when you're rotating, when our students go and they become part of the fabric in that community, they're there for like a year and a half, okay? At least a year and a half, some students 2 years. And why that's significant is you can't avoid but become part of the fabric of the community. You can't avoid but know what's going on, where the supermarkets are, what church you go to, all the events that are going on. And so we've have these students that rotate in these areas, and they go through these hospital systems, And, we work with the Office of Mississippi Physician Workforce. Dr. John Mitchell is the gentleman who runs that. And we work with being able to put seed funding into those hospitals so they could start residency programs and primary care residency programs. Because we didn't have community-based residency programs. We had very, very few compared to a lot of states. But by doing that, you start sending the students there in their 3rd and 4th year, and now they can stay there to do residency. That's an excellent opportunity now to truly improve the health of that community and truly the wealth of that community as well, because every time you start to have more doctors in that area, that's a significant economic stimulus. And particularly primary care, all of a sudden now you can do the prevention, you can do the screening. And when you can do that, you can start to cut down costs on insurance as well. And that starts to draw in businesses. So we're excited. We think we are at the very beginning of transformation. In the last 3 to 4 years, we started out with a medical school, we had 100 students per class. And that's a total, 4 years of medical school, 400 students if you look at our census. We just, in the last couple of years, doubled our class size. We went from 100 to 200 over 3 years, and we've just taken our second class of over 200 students. We are technically the largest medical school in Mississippi. We are actually the #1 medical school in the nation among MDDOs for putting our graduates into rural areas. We're top 5 for putting our graduates into underserved areas, and top 10 for putting our graduates into primary care. It matters to us. It matters to us. We cannot guarantee those kinds of statistics or whatever, but we can guarantee that every day when we go to work, we know what we're teaching our kids to be, and the partners that we're going to have are going to share the same mission that we're going to have, because it's all about Mississippi. And we pray and hope that this dynamic shift and change is going to have a significant impact and transform healthcare in Mississippi and really impact mamas and babies.
Yeah, that's an excellent segue. Each of you are taking a really unique and aggressive approach at not only producing a larger quantity of prepared, skilled professionals, but also a higher quality. And so I want to give each of you the opportunity to really dig in on that. Jessica, talk about some of the stuff y'all have going on.
Sure. Truly, I believe apprenticeships are the way of the future that many of you already participate or seen. And I'll tell you, healthcare is new to the apprenticeship side, especially here in the state of Mississippi. We're very excited. We have just launched the first healthcare academy here in the state of Mississippi. Now, I will tell you guys, we were running out of what they call the closet, okay? At first, a storage closet, but we adapted it and changed it. Oh, sorry. Okay. Is that better? Sorry. So with our apprenticeships here, so just to let you know a little bit about what we are doing, you have your, we base, because it starts with where's our biggest needs, right? We know it's nursing, but what feeds into nursing and what needs to support nursing? So currently right now with our apprenticeships, we are doing the technical side, which includes your nurse aides, right? Phlebotomy. We have surgical tech program, which is a 1-year program. We have our medical assistant program, which then also with our great, wonderful partners who help us out as well there at MGCC, we are partnered that we have just piloted the first LPN apprenticeship for the state of Mississippi. What this allows them to do is the non-traditional way, okay? So I'm going to explain this to you. They do not start off taking the TEAS test, the ACT, and all those other kind of wonderful barriers. I will tell you, we have wonderful workforces, but guess what? Everybody can't stop in doing their job to go to school, right? As much as we have wonderful school programs, because we all have a roof to put over our heads and things to raise, right? But all of these programs that I'm telling you that we're doing right now are earn as you learn. All of these programs that I'm talking to you about, we pay our students while in partnership with a lot of our partners that are assisting us here in the state of Mississippi with Accelerate and SMPDD and different things. But these students earn while they are going to the classroom. And at the same time, they're getting the clinical experience. Actually, they're getting 10 plus more times more clinical experience. So when they finish, they are 100% ready to go to work. So all all of these wonderful programs that, that we're actually doing. But I want to tell you a little bit, because this LPN program is remarkable, and it's with our partners right now, MGCC in the state of Mississippi, that these individuals are taught the exact same as traditional students. When they finish this program, they go 2 days a week to school. They're on the clinicals for 2 days a week. Okay, they go 2 days there and they're on the floors for 2 days. When they finish, they take the NCLEX just like every nurse. Folks, this is going to be just transforming, because when they finish, they're going to be practicing LPNs. They'll be LPNs for 1 year, and then after that, they can take the bridge program and become RNs with 1 year. The whole time that they are working, no debt, right? Able to provide for their families and able to move forward. And this is such a huge, huge thing. And we're so excited. We have our first 15, and I know Dr. Riggins and Gail will tell you we are nervous as could be. We're getting ready to take our test here in September, but also the state of nursing allowed us to start our second cohort. So we have another 24 that have already started on our second program. And I have to tell you, many people, and folks say, well, I don't understand. We have these other programs. I said, let me tell you this. We opened it up without even advertising it, just talking about it, right? Within 1 day, we had over, and this is just internally, we had over 200 applicants. Within less than 3 days of our own employees, we had over 500 applicants. We had to shut it down for only having 20 spots. These are folks that had been nurse techs, phlebotomists. They had worked out in, all different areas of our hospital. They just never had the opportunity to go back and finish it and to do it. And folks, they are remarkable. And I'll tell you, in the beginning, we had some non-believers, okay? But guess what? We got there through hard sweat and tears and working things. I tell everybody, pilot programs are called pilot for a reason. We fix things. We move them. Don't be scared of having pilot programs, right? And I'm telling you, this Imagine 15, I will tell you, they just had their penny ceremony. If you could be there, you would have been in tears with them. It's not only changing for them, it's changing for their families in a lifetime. And these individuals are going to have an ability that they're going to be able to grow, and then even do the RN program, and then hopefully even further keep going on to the MPs and the DOs. But everybody can stop at whatever different thing that they want to do. So we are super excited about that going on, and and have so many other programs that feed into these programs. But all of these programs, these students earn as they learn, and they're able to finish. And we're not here to replace any schools. We're partners with the schools and the different programs. We're working together to knock barriers down and figure out what we need to do differently, right? So those are just a few of the things we have going on.
That's awesome. So, Dr. Larman, I'm going to ask you a specific question, and then you can talk about anything else you want to talk about as well. One of the things we're seeing from an office standpoint is, in nursing programs specifically, is significant challenges with retention. It's not an enrollment issue. It's not a desire to pursue that career pathway. It's that students who get into it do not complete. And it's a nationwide problem, but we're behind the nation here in Mississippi in retention. It just so happens y'all happen to be pretty darn good at it. Talk to me.
Thankfully, we are, but we have put a lot of work into our retention with our undergraduate students. And there are several things that we have put into place. One specific thing that we have done, we have a college navigator that we have had for several years that specifically works in our College of Nursing and Health Sciences. And that particular position, she sees all of our health science majors. So she sees them for all of their advising before they are actually in their program courses. So before they are actually in even the ASN, the BSN, any of those, she sees all of our pre-SLP students, any of our pre-professional programs. She does their advising. So she really works with them to have some of those conversations about career paths And if, we need to take the ACT again, if we need to do just some career coaching and just some testing, and let's see, what is it that we really want to do? Did we come to nursing because, mom and dad told us that this was a great idea? Or do we really love this, And so she really works to help them find which path they should be on. Because even when those students are in nursing, if their heart is not in it, they're not going to be motivated to finish. And so that has helped a lot. That has helped us to make sure that the students that are really committed, and also that the resources that we have are going to the students that are going to really be as committed and, hopefully can finish and can see it through. But we've also done a lot of data analysis. We have years and years worth of data, and we have tracked a lot of what hinders our students' success. And in both of our undergraduate programs, we have worked really hard to get ahead of that. And so both of our programs have early retention plans that when they start to see some of those barriers in those students pop up, when they start to see some of those red flags and some of those things that students that may hinder them, we look at subscores in their ACTs. We look at anything from metrics to home life things that we may know about, any of those things. If there's more than one, then that, kind of triggers another, red flag on the scale. And advisors have lists of students ahead of time. This is done like once they are admitted. None of that information, of course, is before they're admitted, but afterwards, the department chairs are putting that information together and dividing those students up among advisors, so not one advisor has all high-risk students, so that those resources are split up, and advisors are working with those students early. And when they score a certain score on that first test, they're immediately going to see early advising. So it's really getting ahead of just normal life events that these students, because these students are coming in, with needing to work and needing to take care of family sometimes, and, things you used to see in non-traditional students now are, there really isn't a non-traditional student anymore. They all have those challenges. So really a lot of work to get ahead of what our students are facing.
Dr. Subarao, talk about where you're headed. Where's the future for the DO school?
Well, one thing I really want to say with all of y'all, career coaches and things, as we just heard, it's about caring. What we heard over there, it's about caring. We got to get engaged with those students. We have to, there's encouragement, but it's also walking with them when they have a bad day and when they're looking at things. And as was mentioned here, we do the same thing at our DO program. We try, for us, it's about, we want more folks to graduate in primary care and stay in Mississippi. That's really important to us. We have a major access to care issue here in Mississippi. And so what we're trying to do on the front end, of course, we give priority to students that are from Mississippi in our admissions process. Students that are Mississippi Rural Scholars. That's a program that pays for your medical school education. For us, it pays for about 85–90% of your medical school education. So it's a wonderful scholarship that's available to students who are saying, you know what, I really want to practice in rural Mississippi, which is the most counties in the state would qualify. And so that's been a program. We've seen a jump in that in terms of our admissions. We prioritize students. We have a couple of programs we do with certain colleges called direct admission programs. And so when students go into the pre-med sphere, if they are able to maintain a certain GPA and are able to maintain a certain, go through that certain rigorous curriculum, they're going to get an automatic interview. We do a lot with it within our undergraduate campus at William Carey University. So if you have students that are in community college and thinking to proceed in pre-med, that would be a nice way to kind of come in through our program. But for us, our pipeline's really also looking down at the high school level in terms of, instilling that this is a possibility for you. We're the largest medical school in Mississippi. This is a possibility for you. And we want you to think about it when you're, now, so that you're working towards that as you go forward. And we provide advisement and mentorship along those lines to many of our local public schools, particularly in our area. But if you are engaged in a public school anywhere in the state of Mississippi, if you'd like us to provide any sort of advisement or any sort of things, let us know. If you want to come and visit us, let us know. But where are we going? We want to have the premier, we feel we want to have the premier medical school for primary care. And with that in mind, we are very fortunate and blessed to have been afforded a grant, a $20 million grant, that's called the Institute of Primary Care. It's going to focus, all aspects of the Institute are going to focus on areas of primary care. For medical school education, absolutely, but that actually is only where it begins. It's for community physicians in practice. They will utilize the Institute. It's for residency programs that are out there. They will utilize the Institute. It's for hospital systems like Singing River and others. When you're focusing on areas like diabetes, obesity, hypertension, we've got, this facility will allow us to do both educational, sort of didactic kind of training, but also do simulation and ultrasound and other types of diagnostic training. So it also allows us to do more certifications. So this institute we're going to really begin breaking ground on in November. We are hoping that we'll be able to utilize here very soon. The build out is about 2 years, but we'll begin programming with a lot of our rural types of works here going forward. And we're excited about the future. We're excited about the possibilities. If we're all rowing the boat in the same direction, everybody in this room, we're going to come back here 3-4 years from now, and it's going to be a different state. It's going to be a different state. It has to be a different state, okay? So we thank you, we appreciate you, and if you want to engage with us, please come to Hattiesburg. We welcome that.
Yeah, and I think that's an important point. I mean, the need is so great, and I would say the need is so great in other sectors, not just healthcare, but the need is so great. There's no turf war here.
No.
This isn't all of the above. We have to have all of these things pulling if we're going to move the needle collectively as a state. So I would ask the three of you to look outside of the work that you're doing in your four walls. What are opportunities you see as for the state as a whole to improve the triage efforts to get more people ready to serve in the healthcare professional space? Whomever would like to go.
Okay, I'll start. No. I will tell you I absolutely love the fact with the career coaches. You guys are so instrumental because for so many years we focus on this percentage of those students, folks. We are missing the main cut right there. And if we, by knocking those things down, and as I always tell everybody, everything we're doing is for the entire state of Mississippi. The things that we're showing is so we can do it in the entire state of Mississippi, just like you were saying, Garrett, not just for Singing River, but for there, because we want to help do these things because we want to see everyone be able to work along. But it's also putting programs in the schools, so with the CTE programs, right, which are wonderful, love the CTEs, but if a student missed the CTE program, guess what? they gapped out. But I want to tell you something that we just piloted and we are kicking off this year. We've been working with one of our local school districts, and I was looking to see if they were in here, with our Goshen Pascagoula School District, because two things. One, if a student missed it, they gapped, right? The second thing also, the students were finished their junior year. They were missing the senior year. We lost them, feeding them right back into the programs that they were looking for. So now that senior year, they're offering these programs that now we partner with them, and they are now offering a medical assistant. But at the same time, at any time, we helped them structure it to where students can come in or come out at a different portion. The students, when they graduate that senior year, they already have their certification to be a nurse tech, a phlebotomist, and a medical assistant. So all three, when they leave, they can do that. But if a student just wants to come in and do a portion, the school can just do that portion. And folks, it's getting everybody at the same table and figuring out how to do it, how to work together, and then it helps tool you as career coaches to be able to help these students and lead them into pathways. Because these are just a few of the things that we're talking about. But the more that we can knock these barriers down and figure out the things that have been holding us back, right? And I realize we've done things a certain way for the last 20 years, but we got to change, right? And it's figuring out how to change, because you know what the hard thing is, real fast? Those students, even if I want to employ them on the weekends, I can't do it right now because the certification says they have to be at least 18, right? Or graduate. Well, guess what? They're waiting for, 4 more months to graduate. Well, let's just change the language with the program that says, or a graduate, right? Of this, a Department of Labor apprenticeship program or certification. It's that simple. We need them. Y'all need to help direct them. These are the simple type of examples I'm talking about that seem silly, but you got to move the red tape to get there. But by putting everybody at the right table, we can move these hurdles. And those are the type of things, as simple as it sounds, those are the things that are going to change it. And these are students that once we get them in, they're growing and having all these other offerings, and we're giving them ways to get there.
Knowledge. Raise your hand if you're a career coach.
And that's what I would think, is that it's so multifaceted, and that I think for so long we have taken this siloed approach, and it really just takes asking the right questions of the right people. And for so long, I think we haven't had the right people at the table, or we just tried to find a solution ourselves instead of saying, we can, let's call and find out what they're doing, or how are we getting past this, and that's one thing we can pull from COVID, is that we figured out another way to do it. And the students were still okay. Like, in a lot of cases, they still met their outcomes, and they still, did really well. So, why can't we change the script? And why can't we do something different to meet what really is an emergency right now for us?
I think both of these points are amazing, and I absolutely concur. I think visibility for our youth to know that there are these possibilities. Oftentimes I think about, there are ways, we call it Accelerate Mississippi. We heard Representative Donnie Bell talk about his I guess, idea of education being really what I would call a competency, a skill, a knowledge, a tool, that if you meet this mark, you got the education. It's equivalent whether you're at some, this place or that place, there's an equivalency with some level of competency. So if we really look at competency, and we have some students, if we look at that, it allows us to potentially have a rubric that's almost a common pathway by which we can maybe accelerate some of these professions, and including the medical profession for that matter. I think it is critically important. If you look at the DO physician, they're usually a little bit older. The average MD physician incoming is about 22, 23. In the DO program, it's about 26, 27. A lot of our folks have real-world experience. Why that matters is one of the other things that we're missing. You know, quantity is not always quality, okay? Quantity is not always quality. So it is about recognizing the heart. It is about having compassion. We don't need medical care or health care to be McDonald's. We don't need it to be, you're a disease, you walk in, and here's your treatment, you go out the back, out the drive-through. You got to come in. Everybody's a human being, and you've got your own challenges and things that you have experienced at work, the things that you take nutritionally. Perhaps you drink, perhaps you smoke, whatever, these kinds of habits that you bring to the table that we need to have a conversation about. We need to talk about. And we can't just look at you as a disease and come in and let you go, because maybe we saw you quickly, maybe we got to treatment or whatever, but we're really not treating the whole person, are we? We're really just kind of putting a Band-Aid on it. And we really got to have compassion in our healthcare, folks. That's part of what's missing is compassion. So we pray and hope that all of you here, you're doing a wonderful job in your career education. They see your passion, and I think we can instill that love of brother, love of sister as early as we can, and let them know about the possibilities, give them the experience, get them that early experience when they're 18 years old and feel what it's like to be around folks and recognize, I want to be treated a little differently. We're going to have a different healthcare system, and it's going to benefit all of us. So thank you.
Yeah, so we touched on this a little bit, but if you're talking to a career coach who may not have the subject matter expertise in the healthcare field, how would you advise them to work with students to better connect to the healthcare industry as a whole, find out all the offerings that are available that Dr. Larman talked about, or all the different positions that you're hiring, Jessica, across your 3 hospitals?
I think the most important thing is having that partnership with all of you and everything. And I know Stephanie's wonderful. She's up here and already working with David Fava and our career coaches, because we want to bring you in and introduce you, because we got to teach you first before you can teach them, right? And show you all the things and show you all the different things. So when you're talking to these students, you can lead them and guide them and show them how to do. So I know we're personally working on those programs, and then also working on programs that also work with the students, where you can sign them up, 4 or 5 times a year to come see and touch. And then when they like some of those things, we also bring in all of the partners and us and show them all the different ways for them and their parents to figure out what is the right next moves for them, right? And by doing that, but if you haven't set up, reach out to those community folks. If you don't have that set up already, reach out and say, hey, let me come experience. Can I come over here for a few hours? Can I come for a day? Because it's also on us too that we need to educate y'all so y'all can help, steer towards the right thing.
We actually have a fabulous simulation hospital and some wonderful labs. And we have, one semester we have a navigating nursing day, and one semester we have a navigating health sciences day. So those are open to our HOSA groups and our high school groups for our juniors and our seniors. So those are excellent opportunities. You can call our main office and get on our email list. We send those out so that you can bring students and they get to actually participate in some hands-on activities with our faculty, with some of our students, and they get to really see what it's like and see if they are still interested. They get some information about our programs, but they really just get to see if they like any of the things that they are interested in. And it's not just nursing. They have opportunities to see our kinesiology lab if they like the PT and the OT route. And then they also can go see, we have an audiology clinic with our SLP department, so they can go with SLP if that's, a route they think that they like. So they have the opportunities to go in any of those directions with those faculty and those students. So it's a really good opportunity for them to come. We usually have around 300 students each time that come to campus, and we manage somehow to rotate them through everything. And our faculty and our students thankfully volunteer to help me get them through everything. But it's great for the students. They enjoy getting to just see whether they really do like having a part of that.
Wonderful. And I agree. I think getting students the exposure through shadowing, through visiting, our campuses, that sort of thing. We certainly have a number of opportunities for students to engage and visit, both in the summer, because a lot of times in the summer there might be a little bit more space in their life, but they can come and they can visit our anatomy lab, a number of things, our OMM lab. But during the actual year, we do work with the local public school systems like Hattiesburg High, Laurel High, a number of our regional public schools where there are students that are sort of in their STEM area that will come in and get the experience of similar simulation types of experiences, anatomy types of experiences. But getting them those opportunities early, I think is important. And also, they may indicate an interest in healthcare. They may not know exactly where they want to go. Maybe they land as a physician. Maybe they land as a physical therapist. Maybe they land as a nurse or a phlebotomist. Who knows, or a paramedic. You never know, but if they have a little bit of that, getting them the exposure and getting them to some of these sites, I think allows them to get a better feel for those possibilities.
Garrett, I want to mention one other thing on the triage side, because this is such a huge thing that's so important with Accelerate with you all, because as you do great jobs leading them into these roles, is we've got to work from the state of Mississippi on how to upskill our labor force as well, right? Because these folks that you're bringing in, you want to be able to show them that pathway. But also with upskilling and working and now bringing Accelerate and all the right partners together is how do we help all these companies and industries, no matter what they're in, how do we help them upskill to help them move their careers along, that we're showing that success rate, just like Ryan Miller was saying this morning, that we have somebody coming in but not finishing out. So that is another true thing in some of your triage things, but that upskilling and figuring out how to use the resources that we have to make sure that we're putting those resources in true programs that we talked about earlier that are allowing these folks that are working in these programs that we're going to, how do we continue to be able to build them and pay and help them upskill?
Yeah, and I think that's a huge point because, as an employer, if you've got an employee that understands the work culture, understands the expectation level, but just doesn't have the actual technical skills, then you're missing an opportunity, and that individual is missing an opportunity to really build a relationship and lifelong employee that could be a true win for the company. So at this point, unless there's additional points that y'all would like to talk to, I feel like we've got a pretty feedback from the crowd so far, so I'd like to offer the opportunity to ask questions. All right, there we go.
I can be pretty loud, so. Hey, guys, my name is Joseph Knight. I'm Vice President of Workforce Solutions at Meridian Community College. And we have had a wonderful opportunity through the years of being with Gulf Coast. Accelerate Mississippi and ARPA. A model of apprenticeship. So the reality is, how do we work towards a state effort across our hospital associations to be more open to that? That would be my question.
It starts with getting everybody at the table together, and I know Dr. Riggins will tell you, we so much time say, I understand this is what the governing is, but how can we change it? Everything from, we're all struggling right now. We don't have enough nurses to precept by the rules that are, quote, precept one-on-one. It's certain things of saying, hey, how can we move that model to having a 2-or-1, or how can I have an oversight preceptor and an apprenticeship program a little bit different than your other program in order to do things this way and that way? And it's sitting down with getting the right people at the table so we can sit there and talk about it, because that is a major bottleneck, what you were talking about. And we are all struggling because that same reason, if we can't offer preceptors for their existing students, you can't have enough students to do the thing. So we've got to sit down and get the right people at the table and say, how can we do this differently, right? Here's an example. We've done it this way. How can we do it in every model, in every row? Because we've got to change those things, because that is what is holding back. And it's holding back, but we've got to get those right players at the table so we can all sit there and say, how do we do it differently? How do we make this happen?
You have a pilot program that you're doing. That's, showing the results of this pilot, is, I think, going to be awesome as it relates to that, I think. So it's great.
My question was similar. However, I was going to ask about, because we already deal with the preceptor issue, so yeah, I know where we are on that, and that's a major barrier that we've got to figure out. But what about instructors? You alluded to this earlier. We are wall to wall with nurses. We have 500 nursing students in there. We can't fit another one in there. If we built another building, we wouldn't have the teachers in there to teach them. Because in triage efforts for your companies, you need nurses, and we need to provide nurses. However, because of your need for nurses, our nursing instructors are headed to you. And so there is a constant battle for, I say battle, not really, because we work wonderfully together, by the way. We do, like side-by-side partners. But we've got to figure this out. And so I was going to ask maybe how y'all are doing this, but also how we can better partner to make sure that we've got the instructors that we need to make sure that we can provide the nurses that you need and other healthcare professionals.
We have worked out a couple of joint positions with some of our hospitals where, we have faculty that will, commit to maybe serving on some of their committees, and will have certain hours that they will take students to certain areas, maybe where they particularly have lower staff numbers, and the hospital will fund a certain amount towards that faculty line. We've had situations like that. We only have a couple positions that are like that, because if you get too restrictive, then faculty, that can become an issue. Being in the position that I'm in, if you get any higher, they don't necessarily like to hear this, but you have to keep your faculty happy. It's work-life balance. It's the benefit that they have a faculty position. It's the fact that they can make a couple of changes to their schedule here and there, and it be okay to go pick up their children. It's the clocking out and clocking in. You have to look at the things that you have to work with. And, it's the truth of the situation. And you will have, thankfully, during COVID, we may have replaced a couple of positions in my institution, and that was it. Because we realized the priorities and what was important, and we worked together, and we swabbed students in the parking lot to be able to have class just like everybody else, so it wasn't easy by any means, but we made do, and we did what we had to do. But I think you have to understand what's important. And, no one takes a faculty position, I don't think, for the get-rich-quick part of it. And you have to look at what you have to work with from, what are the benefits of that position. And we have done a lot since COVID to really have myself and our department chairs to have a more appreciative culture. And we have done a lot to change some of just that feeling of what our culture used to be. And we have kind of let that bleed into our students, and we've just, I've spent some of my time and my resources and my money to get them things, on Nurse Practitioner Day, Nurses Day, Nurses Week, Teacher Day, things like that, just so that they knew that, sending cards for them finishing school, for them, getting their degree, or, having a baby, things like that. I mean, just to change the dynamic a little. So.
I'll be brief, and the question was really about, I think, increasing capacity for nursing. On the physician side, we also run into a capacity issue. There are a number of factors that are very concerning, at least we call it a triage perspective. At least a third of our physicians are at retirement age. Okay, so wherever we are, where we have the fewest number of docs, guess what? We have retirement age right now. On top of that, COVID burned out a lot of nurses and a lot of doctors. It did. That's a reality. And so that has transformed practice. Then, of course, just the dynamics of finances and healthcare and insurance. We're just seeing closures and things of that nature. So, yeah, there are factors that kind of hit on all sides. One of the things that's been, I think, a blessing for us, and I don't know if there's an analogy in nursing, and there very well could be, but at least for us, when a physician is in training, they are under a sort of a state license. And so for us, we try to build with the residents that are going to be our new crop of doctors that go out there. We try to work with them and build with them. We offer them opportunities to come to our medical school to teach. And so we bring them in to do laboratory teaching, and then they also become very facile with helping so we may have physicians assigned to a physician or two, but they can use those residents to help augment that. And that allows it to be a little bit more, that helps us with capacity. So that's one solution that I can share.
And as you know, as well, I think some of the important things are the industries also offering help and saying, hey, you may not have somebody, but I do have a few that can do it. Let's talk about how we can change things or schedules and offer you some nurses part-time and some other things. But another big number one barrier is also the level that they have to be in order to teach. And I will tell you guys right now, if we can change that rule, and I don't shoot the messenger here, but I'm being honest, I would rather have a nurse, an RN, teach a class that's got 15, 20 years and has the love and the passion, even though they don't have the master's degree, and being able to do that. But now I understand we have to have certain levels, but there's certain things that we can take away right now. But it also means that we go in there and we give them, but we do an expedited thing and train the trainer, because you got to have that right person with the heart they've been talking about. You got to have that right person to teach. But we find those right ones who want to do it, and maybe the barrier is the master's degree, right? But they got that experience and they got that passion that they can also become teachers and instructors. And so I'm telling you, we could fill some of the gaps that way, and also in some of the other levels that we require for certain things.
Good morning. I'm Linnell Weems. I'm Executive Director for the Mississippi Center for Quality and Workforce at the Mississippi Hospital Association Foundation. A couple of things I want to let you know. Mississippi has just been awarded their first apprenticeship program in nurse residency. Dr. Melissa Temple and myself and Dr. Tribble, we were all instrumental in putting that together. So we have gotten now our first RN nurse residency program. We've also developed a model building on that, going from externship through a nurse residency, which is pre-licensure through post-licensure and practicing nurse. So we are working on a pilot for that, and hopefully we'll be partnering with hospitals and schools of nursing throughout the state. And if any of you all are interested in that, contact me and let me know, because we're starting to entertain some information, participant information that wants to do that. So we have also seen this need for an apprenticeship type model preparing our workforce. But it's a innovative model that's different.
We're excited. Thank you for sharing that. I know Melissa really wanted to be here and probably would have been 10 times the moderator today. But unfortunately, she tested positive for the flu on Monday. So, other questions? About halfway back.
In order for us to prepare for the workforce crisis that we know that exists in healthcare, in order to ensure that we're having these needed conversations, do we have a communication plan in place to have these meetings, to have those conversations, so it's not delayed year after year, because it is very important that we address this now rather than later. And I think the communication piece and getting the right people at the table has been something that has been lacking in the past. So I think giving a clear communication plan will be very helpful, so we can start having those conversations today.
Yes, I think you're very correct, and it's things like this that help bring everyone together. So then, because I'm immediately saying, hey, I want to talk to this person and this person and this person. Let's all bring in and using the resources. I think bringing everyone together, because just like you were saying before, so many of us have been working in silos. And so by pulling these things together, that's how we're going to make these changes. And I think you're exactly right. Like, let's just not, I'm one of those things, like, let's not talk about it. Let's do it, right? Let's figure it out. And so I think that's a definite great takeaway in making sure that we are getting these plans and putting things together, and also having one spot so we can have like sight into what other folks are doing, and not just, in individual silos. And hopefully we can work with Accelerate on that. And I love these ecosystems and everything like that, that they can help us navigate those things and pull those things together.
I think Accelerate this is where the communication, we can form a communication plan that's effective for the state.
I would say, again, this is the time of the year that we do this event on purpose. This is to bring everyone together to assess, are we addressing the barriers, or are we just kicking the can down the road? I also think you're going to hear during lunch about sort of what does a true state strategy look like, and how that can hold us all accountable for not just saying what we want to do or putting a plan on paper, but actually delivering results. And so I think that's why we exist, and certainly healthcare is a priority to us. And so this hopefully is an opportunity to unearth some easy wins that we can all collectively get as a state.
Hi, I just wanted to offer something at Mississippi State, and everybody has trouble hiring instructors, and faculty and professors. I'm not sure what level of school you're in. But one of the things that we've done recently to address that is create an entire career path for professors of practice and clinical faculty that creates some flexibility for some of those barriers of having to have a certain degree to get into traditional roles.
We recently started partnering with Singing River Health Systems with a different funding stream than we usually use. We're now using our TANF Career Step funding, and just started partnering with them on their CNA, and they're stacking those credentials leading into their LPN and RN in their healthcare academy. So we're very excited about this new opportunity, and we're hoping that other hospitals in the area will possibly, start doing this in the Twin Districts area as well. I mean, we just think we know that the earn and learn, we know it's a great way to do it, and we really want, we train a lot of CNAs. We want to see them continue in that career pathway, and we're very hopeful that's what they're going to do over there at Singing River. So we can't wait. We just started the first group, and we're very excited about the partnership and excited that they've just, been able to pull this together and do it. So thank you. But I wanted y'all to know too that that other funding stream is out there and that it could possibly be done in other areas.
And that truly is an example as we're sitting with the partners and, as we sit there and navigate and say, hey, help us figure out, and sitting, and I know Tracy's in here and Gary, and we're sitting with all the partners, and it doesn't matter to me who does what, where does what. I just sit down, we're sitting at the table and we said, help us figure out how we can change something to make it better, right? Where are resources? What can we do? Because, industries do need help and also as well, but there are some resources that many of you in your different agencies have away, and I so appreciate them looking at a different way of looking at something and able to help solve the problem, because like she said, the way we were doing it before was not working. We said, well, could we work it this way? She went away, came back, and said, I think I found a way. So immediately, that's what I'm telling you. It's all of y'all and your ideas and what you do, and help getting there, because you guys help bring those answers as well back to the table and make it successful. And can't wait for the results so we can show that it actually works very well.
Hi, I'm Amy Hudson. Sorry. I'm a Long Beach High School career coach, and my question is regarding retention. You mentioned what a large problem that was. My question is, what are the reasons that we're losing workers, and what is being done to incentivize or keep our highly skilled workers here in the state of Mississippi?
So two different issues, and great question. The retention rates that I spoke about earlier and that Dr. Larman addressed are retention rates in nursing programs. In other words, we fill the program up when the program starts in August, and by the time May gets around, a third of the class has already dropped out. And so then we can't go back and backfill that space, and we're not maximizing our capacity. And so one of the things that the state is doing to address that, and I appreciate the question because it was actually what I was about to hit on, the navigator role that Dr. Larman and MUW have had in place. We worked alongside actually Representative Donnie Bell this year to get a small amount of money set aside for a nurse navigator program, specifically at community colleges for nursing and allied health programs. We have seen models like MUW, but also in other states where this has made an impact. We opened that up this year and just awarded last week 11 of our community college partners are going to have nurse navigators, and so we'll see. We're gonna monitor that closely, but we hope that makes a dent in making sure that people that enroll in our nursing programs actually have better success rates of completing and going into the field. As for the retention of nurses in the state of Mississippi, I'm gonna hand that to someone else.
You are in a huge passion of our heart, and I know Stephanie will tell you, we recently just met with all of our managers, and we realized it's all about resilience, right? We cannot keep doing everything the same way we're doing. I looked at them all and said, guys, we can't keep hiring 2,500 and 2,000 people a year. This is incredible. We can't do it. We've got to figure out what our employees are needing and what they're wanting. We went out and surveyed them, and it's all so many things go back to mental health and wellness. And mental health and wellness is more than even just the emotional part. It's the financial part, right? It's about being flexible. It's about being able to do there. We took some of the results, and this, I'm just using a few examples of us, and I know there's many of y'all that are probably way ahead steps of us, okay? And that we had to get in there and figure out what is it that they're asking us for? What is it that they need? Because we are gapping. We're gapping. And we as industries, because you guys are supporting them, getting them in, we've got to keep them. Right? We got to figure out what those things are, whether it's changing schedules but whether it's helping them on the financial side, helping them find ways to get rid of their student loans and changing different things that we're doing to take those burdens off, help them with their development, help teaching our leaders to make sure that they're listening and give them the tools and the different things they need in help responding, right? You got 5 generations right now working together, guys. And all of us have different ways of thinking, different stuff. What's important to me is not the same that's important to every one of us in this room. And so we've got to change. And that's why I said, guys, it's not them, it's us. We've got to figure out different ways because you guys are feeding in the pipelines. If we don't keep them, we're not help resolving that resolve. And so by making some of these things, and we're putting a huge effort and showing the expense of what it costs for turnover, we're taking those dollars and investing it and doing what some of the things you guys have been talking about doing. Even though we felt like we were doing some of those things, you've really got to get in there and get that pulse. Maybe that was important to them 2 years ago. It's not important to them. Like, you've got to figure out what it is that you need to do to help make those adjustments, because life's hard, life's difficult, and we've got to figure out how to make it all work together.
And I think that circles back to actually a point Dr. Subarow was making earlier, the value proposition of working in the healthcare industry. You know, when we are selling healthcare careers to our people, whether they be people in high school that are looking to make a post-secondary decision or adults that are looking to recalibrate, healthcare is hard. It's not an easy job to be a nurse dealing with bodily fluids and very, very difficult situations of people who are struggling. And people need to know that before they pursue that career. They need to understand that it's not going to always be fun every day that they go to work. But they also need to understand the value of what they provide to their community, to their city, to their state as a whole. And honestly, I think this generation values that as much as they do the money. They want to be part of something bigger than themselves. And so that's a huge opportunity for us as a career coach strategy for the state, or just anyone in the system, to better communicate to the people who are interested in these careers the value that they will provide for their community and for their state. And that, in turn, is going to keep them here more than any dollar amount, as long as it's a livable wage.
And I know from the educator side, we have also worked with our student organizations to put in a lot of self-care and do a lot more with speakers coming to talk to the students about self-care and really work with them on what that means and building resilience. And we also have a living learning community where one of our dorms is for our health science students. And housing worked with our nursing department, and we worked on some motivational posters and resilience builders and things like that we used to decorate the living learning community, and some things that we put over there for them to kind of, just be a little bit, just to kind of help, with that. And we've also opened up online opportunities through our counseling center. So now, since we have such a large number of online students, especially with our RN to BSN program, that now if they are in Mississippi, they are able to use our online counseling services through our counseling center, and that's free for our students that are in Mississippi, and even if they're online students. So that's great that they will have that service as well, especially because those are practicing nurses that are just working on getting that bachelor's degree. And then we also have that flat rate tuition for that group, which is wonderful value for them, and they can keep working. So that's always been appealing for that group.
What is the role of nurse practitioners in rural healthcare in the state, and do they have what they need? Not to introduce any controversy here, but do they have what they need? Do we need more of them? What's the lay of the land with that?
I think you're going to have a divergent opinions on that, but I would say I think you're going to have divergent opinions on that with what you have up here. In our estimation, there was a publication by Hattiesburg Clinic. It's been cited by by a number of national outlets, and it looks at quality of health care. And so one of the questions kind of being asked is if a nurse practitioner can go out to a rural area and have a full scope of practice, and that would take the place of a physician. We do not think that on the physician side, we would not agree with that. And as I said, there's going to be a divergence of opinion on that. But we feel that way for a number of reasons, one being educational, residency, things of that nature, things that you have to go into healthcare to be able to practice a full scope of medicine. But also because we're just looking at some of the quality studies. Just the quality studies we see, the one that was just published by Hattiesburg Clinic that really looks at a team-based model. So with a physician and a nurse practitioner together, working together for the betterment of the patient, that's the best quality and that's the lowest cost. So that a dual model is the way to go. And we certainly would endorse that. But as far as independent, we couldn't support that.
I would say for our state, the data shows that we have enough. However, we always have more applicants than spaces. So we always have plenty of NP students, and they always find places to work in Mississippi. All of them, just about every year, all of them stay in Mississippi, and most always it's somewhere rural. A lot of them do go to somewhere rural to do their clinic time as well as to keep their positions in a collaborative, of course, relationship. And so I would say that they serve a purpose. I would say that they are serving a good need right now in the capacity that they are in. My background is not nurse practitioner, but you will ask any nurse practitioner and they will tell you, of course, that they will advocate for the full scope. But they are serving a good purpose right now, and I think that they are doing a wonderful job in the areas that they are in. At least I know for our student group, they are doing a great job in a lot of rural clinics that we serve.
Hi, Judy Johnson with Mississippi State Center for Advanced Vehicular Systems. Our office is here in Canton, but I was just wondering if you have addressed the need for, in healthcare, also continuous improvement. We teach a lot of manufacturing courses for professional development, but have added, some time ago, added a lean for healthcare. And we find that nurses, industrial engineers at hospitals all over have really enjoyed taking those courses, or Six Sigma to reduce variation, improve quality. So there's a lot in addition to teaching the medical part. I was just wondering if you guys have programs to make sure that that other type of enrichment and continuous improvement is in place.
It's wonderful to just hear that you have that, because I will tell you from healthcare side, you don't. I'll give you guys a hint. I don't come from healthcare. So my prior life, I've just only been in healthcare for the past 4 years. Jumped in right before COVID. They kind of baptized me by immersion. And, but I will tell you, because I was with chemical companies before, right? And love that and the different things. So that's what I'm telling you. There's things that you all are doing that we may not know. I mean, I don't know, but I know the thirst for knowledge and wanting to, I can see where that would help so much, because we did that in the manufacturing chemical world, that I could see where that would be helpful, and I could see where we could bring services like yours and even partnering here and bringing those capabilities that way that maybe, you know, all hospitals and clinicals could resource in different areas, you know, and pod them to where they could send at different times. So that's what I'm saying. That's what's so amazing, because I'm sitting here listening, I'm like, wow, I didn't even know that existed. So those are the things that we need to pull those resources together so we can all utilize them. And I don't know if you all are utilizing it on, you know, even on the institutional side of some of the extra things that she's talking about, but those are the great things to hear.
Information, and we can get you connected. We do these classes in Canton, Starkville. We've even done them on Meridian because of the Anderson population there. So yeah, I'll be glad to share about that, or manufacturing.
Yeah, we would welcome it as well, conceptually, very critically important. And we do some of these things, but this is what the Institute for Primary Care, what we're envisioning is the ability to do this on a regular basis for a lot of, you know, a vast number of folks. So we would love to chat with you later about it. Thank you.
Well, this has been a great discussion. I really appreciate everyone coming in. We'll let you go mingle and sort of ease your way back to the big room for the next session, but thank you so much for coming.